everybody. Welcome to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing private practices from all over the United States. And every week we have someone brand new, a new specialty, and most importantly, we have brand new perspectives. It's really important to get really good information, but also by the experts. And today we have a really awesome special guest for you. I have Dr. Nosson Goldfarb. He is the owner of Integrative Medicine and Wellness Center. So, Dr. Goldfarb, thank you so much for joining us and very happy to have you today.
Thank you. My pleasure to be here.
Yes. So, would love to start out with getting to know a little bit of your story. So, we always love to know our providers and what had inspired you to get here. What made you want to open up your own practice?
It goes back a few years. I've wanted to be a doctor since I was four.
Wow.
My father was an old-time general practitioner, GP, and he had his own practice, and he used to see a lot of patients. They would sit in the waiting room and just schmooze. And it wasn't like, one or two. It was like 10, 20, 30 people just sitting around and talking and politics and sports and whatever, and they had a great time. And he was one of those old-fashioned doctors, and I felt like that's kind of what I wanted to follow in his footsteps. So I did go to medical school. I trained in adult and pediatric allergy immunology,
Hmm.
and I practiced basically traditional allergy medicine for about 5 years. And during that time, where I was practicing, I was working for a company many people have heard of, Kaiser Permanente.
Yep.
And it's very popular in California, but we used to have it in Ohio. And while I was there, I used to see a lot of patients who other doctors didn't really know what was wrong with them, but they said, well, maybe it's an allergy. And they sent them to me. And I knew fairly quickly that this is not an allergy problem. But instead of just sending them off to the next provider, I decided that, well, why don't we try to figure out what is going on with them? So that is what sort of sparked my interest into sort of alternative medicine, complementary medicine, that venue. And as I read and educated myself about this field, I just started asking my patients questions.
Mhm.
And as they would share with me their story, it became clear that something was going on. And I would just sort of put the pieces together, and I would read about thyroid, I'd read about cortisol, I'd read about hormones, all sorts of things. And as I learned more and more, I would sort of implement these into helping patients. And almost invariably, every patient was like, listen, I was like, I don't really know what's going on with you. I have a feeling that it might be this. So, are you open to trying something new? And all of them would say, yes, I'm suffering. No one's helping me. I'm willing to do anything. And as we did this, I started seeing patients get better. And it was really about listening to their story and trying to figure out what is going on, what's the underlying problem. And as we dealt with patients in that way, they started getting better. And so that I became very passionate about helping people in this way.
I love your story. One, it's always great to hear about people that have had great mentors in their life. And so I think some of the best physicians that I've met, they've had either someone in their family or they maybe the same thing has happened to them, whether they tore an ACL or they thought they had some incurable disease that no one could figure it out. And so they decided to be the entrepreneur in their own problem and venture forth and figure out what it is. And so I see the compassion that you have towards others, the desire to get to the root cause of what is really the underlying issue and some of these problems that people are experiencing. So I would love to know from you.
Well, let me just address it.
Yeah.
As I think about it, I realize that my father was really an out-of-the-box thinker.
Mm,
Very creative, came up with lots of ideas. And some of them were a little out there, so outlandish, but it was just that curiosity and ability to think outside the box that he was a very conventional physician,
mm,
but his patients loved him and he treated everyone with a lot of compassion.
mm,
He was an excellent diagnostician. and he was able to, just really think outside the box and not just get stuck
Hmm.
on
I'm
things.
sure he asked you a lot of questions as a kid. What made you think about, the next thing. It's
Sure.
not always what it seems. This is not what your eyes are seeing right now. It's the answer is beyond, right?
Yeah. Maybe I picked up his genetics or something.
No, I think that's fantastic. And so, out of the people in your community that you're serving, what do you find is often maybe the most common areas that you are treating, or maybe what is America struggling with right now? What are some of the biggest, struggles that you find that we're really facing maybe in your community, but also, globally?
So I think there's a number of things that, to answer your question, that people are concerned about or worried about or struggling with.
Mhm.
And it falls into one, areas of lifestyle. I think people are tired, fatigued, stressed.
Yeah.
There's a lot of people are struggling a lot with their weight. They're struggling with their sleep, and they're struggling with their diet and nutrition.
Yeah.
So that's sort of one area that I do see a lot of people, and a lot of people come to me specifically because they want hormone therapy, and I use what I refer to as bioidentical hormones, which means that these are hormones that are biologically identical to human hormones. I
Mhm.
try not to use the term natural hormones because, for instance, Premarin, which is a a pharmaceutical product used for women in menopause, comes from horse urine. So that's very natural.
Yep.
It's just not biologically human identical. So
Right.
I use bioidentical hormones, and a lot of people come to me specifically for that.
Hmm.
And the other area that I also see patients besides just in the areas we mentioned is I also see patients with opiate addiction.
Mm.
And this is just really it's really a microcosm of what a lot of people struggle with, which is just trying to find joy and happiness and satisfaction in life, because that's really the beginning of addiction. Is really all of us are really searching for a dopamine fix, and you can get it through lots of different ways. It's just that some people get stuck with an opiate addiction, which is takes it to the next level, so to speak. But these are things that we all struggle with, and that's what I'm trying to help address people with, both their underlying, health concerns, but also in their perspectives and how to, look at life and try to figure out, how to live a healthier, happier, more fulfilled, satisfying life.
You bring up a lot of good points. And I think a lot of what you're talking about, a lot of what you're helping people with are some particularly hot topics at the moment. People really struggling with their diet, their weight. We've seen the craze with GLP-1s. We've seen a lot what has happened there. And, but we've also seen a lot of our communities really struggling with all kinds of opiate addiction and people really struggling, whether it's because they were had a surgery and they got addicted, or, they're in a lot of, pain, mentally, and they're not happy with where they are in life and they're escaping, through other methods. And it's really sad and it's hard. And I think, in this world, we're so used to we get things immediately. Everything's Amazon, right? 2 day shipping for everything. And um, you know,
That's slow, by the way. Right?
yeah, it's really overnight. That you can get it between the hours of 7 to 10 a.m. Overnight shipping. And, it's the world of medicine, I think, is a little bit different. I think sometimes we also come in with the expectation that, things happen overnight and and maybe some things do resolve very quickly. But I think, what would you say to that? I think the way you listen to people, your approach is so different. What you do, and all the ways that you help people is so different. Can you explain to us, how do you approach people when they're coming to you with, such, difficult ailments to address? And sometimes it is a journey, or sometimes you found the missing piece of the puzzle and you can treat someone rather quickly, but how does that work with you? How are you treating patients?
So let me give you a metaphor.
Yeah.
So buildings, we can build buildings very quickly,
Yeah.
but plants take time.
Yes.
They need to be nurtured. And my approach to medicine is this is more organic. This needs to be nurtured. So yeah, we can build buildings very quickly, and sometimes we can stop pain immediately, sometimes. But in order to really get into healing mode, we have to think of it a little differently. We have to think of this more organic, more like a plant that you need to nurture. It takes time and it's slow. And so my approach is really twofold.
Mhm.
The reason why I name my practice integrative medicine is because I integrate conventional allopathic concepts
Sure.
with alternative complementary concepts. And I like to use the word concepts because it's not necessarily that, it's a modality or a treatment or a medication or a supplement, but it's an approach, it's a way of thinking.
Yeah.
So I like to think of all of the things that I use as tools in my toolbox.
Mhm.
Some of them just some of them can work quickly and some of them take more time. And what we're trying to do is we're trying to put together an approach that utilizes whatever tool is going to give us the best outcome.
Mhm.
A jackhammer is a very dangerous tool,
Mhm.
but it's the right tool if you're trying to, make a hole in an asphalt road. But
Right.
it's not the right tool for your bathroom,
Yes.
right? So we need, so some tools can be quite, dangerous, and you have to use them properly. And so a lot of people are like anti-medication, anti-medicine, and I think that's the wrong approach. Medicines are very effective, used properly. But if we think of them as the solution to the problem, then we miss the point. It's a tool to use on a road to recovery. And sometimes they're very powerful and sometimes they're necessary. And at the same time, we want to, build from the ground up. Diet, nutrition, I use a lot of supplements.
Mhm.
In and of themselves, they can be beneficial, but they won't necessarily solve the whole problem. So we have to integrate the different types of modalities and different types of tools to get the outcome that's going to really help us get to our goal, which is health and wellness.
Absolutely. There's a balance and a fine line. And I appreciate that because, I think, it can a lot of people can easily go one way or the other, and then there's no in between. I love you got to use things properly in the way it was intended, and so I appreciate that. And something, you've brought up a lot of good points already, but something that I do really love to talk about is, I think every field struggles with maybe a common misconception, or you hear about old wives' tales, and um, they're largely not true, right? That's what that all kind of means in a way. And there's maybe a 1 to 2% truth in that, and then it gets blown out of proportion. So out of all the things that maybe you've heard over time, or people come in with questions and they say, "Oh, my friend told me this. I saw someone that does something similar to what you do, and they had this experience." What are maybe some of the wild misconceptions that you've heard in your time, and what would you like to debunk and set the record straight on, maybe?
Okay, so there's two things I'd like to share with
Sure.
that. So one is from the point of view of a lot of the people who are sort of holistically integrative medicine leaning. They specifically come to me because they don't want to go to a conventional medical doctor. And sometimes they say, well, like, no, I don't want to treat the pain because the pain is just a symptom of something else going on. And, I want to get the root cause of it. And I don't want to take any medication because I want to know what's going on underneath.
Yep.
And I understand that perspective, but here's the problem with that. Pain is very stressful. And I deal with a lot of chronic pain. And when the body is stressed, and when I say stressed, I mean physiologically stressed. It could also be emotionally, psychologically stressed, but I'm specifically referring to physiologic stress. Then the body can't get into healing mode. And in order to somebody into healing mode, we need to take care of the pain. Natural remedies oftentimes are not sufficient to take care of chronic pain or even acute pain. And so that needs to be addressed and dealt with and put in controlled in order to reduce the stress. And once we get somebody, reduce their stress enough with the body, then can get into healing mode and rejuvenation mode.
Mm.
So it's very important to actually, and sometimes we need to use, that jackhammer in order to be able to get somebody in, enough pain relief to get them sleeping, to
Sure.
get them to, just like to reduce that stress level enough so we can get started getting into healing mode and we can do all the other holistic things that they really came for. So that's one avenue where there's a lot of misconception.
Mm.
Another area I think that's important to recognize that and it comes from some of the conventional medicine realm is that hormones are bad and their hormones are dangerous.
Mm-hmm. Yeah.
So this became very, very, very clear to me back in 2000 when a famous study, I think it was called the Nurses Study, came out and looking at women using hormone replacement therapy. And they basically found that there was an increased risk of breast cancer in women who were on hormone replacement therapy for more than 5 years. And the entire medical world just went berserk. Like it took everybody off hormones and they were getting crazy. And then doctors started telling the patients that if you go on hormones, you're going to die. And it's like, it was horrible. I actually had, when I was at the time, I was actually working for Kaiser and the head of the OBGYN department put out a statement said, we no longer we're going to put patients on progesterone. And I wrote him back and I said, this study was not looking at progesterone. Progesterone is a naturally biologically identical human hormone, and that's not what the study was using. They were using progestins, which are synthetic progesterone-like compounds, and they're not the same. He says it's all the same. It doesn't matter. The risk is the same. And I really took issue with that because it's what the body makes naturally, the body knows how to metabolize, knows how to utilize, knows how to break down.
Mm-hmm.
And it's not dangerous. Used properly, these hormones are they're life altering, they're beneficial, they actually promote health and wellness. Estrogen, which was the major culprit in driving the breast cancer risk, has bone protection and heart protection, and just women feel better when they're on hormones.
Mm-hmm.
And it became one of these things like the whole world became like, just went, upside down. Now, subsequent to that, a bunch of researchers looked at that data and they realized that no, they really misinterpreted it and it was really wrong. And they were saying like, oh, there's 8 more cases per 100,000 women, patients who are on this for, more than 5 years, which is, your risk of getting in the car and driving down the street and having an accident is worse. Okay. So, you have to put it in perspective, but it was like, that's one of these things that just like, in the conventional medicine world, was just like, this is blown out of proportion and it's wrong and it's actually hurting people because women were suffering terribly
Mm.
because their doctors were not giving them the hormone therapy to make them feel better.
Yeah, it's you can't always, I guess, believe everything that you read. You would hope, but you have to dive into the particulars. Kind of what we talked about here in the beginning. What is the root cause? What is the why? Let me understand this more. And I think that is very, unique to your approach and to also what you're doing. It feeds directly into what you're doing. I'm sure the people that you see maybe have seen 10 other physicians before you and feels like they're some walking question mark. No one can figure out what's wrong with me. But the thing that time and time again, you're reading these journals, these, different things. You're listening to your patients. You're listening for the key words, the what they're doing, how they're feeling, to get to the root cause. And I think that's so important, and really truly unique to what you're doing at your practice that makes you successful.
Yeah, thank you. The other thing I would like to add to this is that in my approach, which I think is different than what a lot of patients experience
Mhm.
from their conventional doctors, is that there was a time period in medicine where whatever the doctor said, that the doctor knows best, and that's the way you have to do. And that's not true today. And what patients really need today is they need somebody to explain to them what their options are and inform them, and so they can actually make a decision and make a choice. So instead of doctors telling you, no, you can't go on hormones, I'm not going to prescribe them to you because there's a risk. My approach is that here's the information, here's the data, here's what the data says. This is what we think it means, and you decide what you want. If your desire to feel better now is more than the potential risk of something happening down the road, then by all means, we'll give you the hormones. And if you feel that the risk is too great for you and that you don't want to go them, that's a perfectly reasonable choice. And so our job as doctors is not to tell patients what to do. It's to help them understand what their options are and what their choices are and help them make the best decisions for themselves.
Absolutely. 100%. And why you're throwing out all these ideas and pro tips, something that I would really like to ask you, it's kind of a two-pronged question because I think a lot of what you brought up today is really important, not only from the patient side of things, but provider side of things. And so I'd love to ask you a pro tip for both subsets of people. What is something that we can do? As our normal everyday people, non-provider, non-clinical, to do that can move our health into a better trajectory today. But then also for the clinical folks that are listening in and the folks that are, private practice owners, is there something that you particularly do within your practice, a pro tip for them every day that is really important to how you treat patients, or a piece of technology that you have that you wouldn't be able to live without, or something that just really helps you move the ball forward with your practice?
So, okay, fine. There's two parts of this question. One, what do we have for the everyday,
Our average Joe.
average Joe, right, on the street? And then what do we have for patients, professionals who are treating people?
Absolutely. Yep.
So there's three things. They're very fundamental, and there's nothing that I'm going to say is going to be anything new. I'm just going to reiterate something that people know, but maybe I'll couch it in a way that's approachable. There are three things that are important for us just to live healthier, longer, better lives. And that is one, be very protective of your sleep. We don't get enough sleep. We don't get good quality sleep. And if we just put a little more effort into making sure that we get better sleep, that is probably the number one most important factor in living longer.
Mm.
And so one practical tip and we know that screens disrupt sleep. So if somebody can just turn their phone and their screens off an hour before bed, that might go a long way in terms of just helping them get a better quality sleep. That's
That's awesome. I mean, yes, there's people may know, but you know what? It's like for the people in the back, all, hear me now, it's
right.
you always need a reminder, life, where it's fast paced, like I said, Amazon everything. And, we forget to be human sometimes. We forget to do the basic, care for our bodies, just because, we're moving on to the next thing.
Right. Sleep is the
Oh.
number one thing where that's when we rejuvenate, that's when the body heals, that's when cells, do their rejuvenation. And so sleep is extremely important. The other two things I wanted to mention were trying to improve, even if it's small little things in our diet. So just getting out, just trying to reduce sugars and processed foods as much as possible and try to add more whole foods.
Mhm.
And then the third thing is just move your body,
Yep.
right? You don't have to join a gym and you don't necessarily have to buy, weight equipment, but just make sure you're moving your body. If I had to pick the number one most important exercise to do, I would certainly say it's resistance training,
Hmm.
right? Because building muscle mass and doing resistance there's a lot of benefits from it. Hormone improvement and strength and balance, and it's extremely important for people as we age. But those are the three things. Just focus on sleep, Improving your diet, and it doesn't have to be all or nothing, just small little baby steps, and then getting your body moving. So those are the three things I would recommend to your average Joe. They're all three of them are doable. We're not talking about going from 0 to 100. Just make small little baby steps. Whenever I encourage somebody to change a habit, I always encourage them, pick something that you know absolutely you can attain. An example, can you walk 5 minutes once a week? And everybody says, oh, you sure, I can do that. Okay, fine. Can you commit to that? Yes. If once you commit to 5 minutes once a week, then you can make it 10, then you can make it 15, then you can add 2 minutes, but it has to be attainable. The New Year's resolution of joining the gym, and I'm going to go, 5 days a week, then by February, you already canceled your membership. Pick
Yep.
something that's small and doable and attainable, because then it gives you the positive feedback that I can do this, and then just add to it slowly. It's very simple. It's not
I
easy,
like that.
but it's simple.
No, it is. And I think that's what we need, though. I think we need to dial it back to basics and do something that, like you said, we're not taking it from 1 to 100. Let's take it 1 to 10 first and let's see how we make out. I
Let's
think
take it 1 to 2.
okay, we're gonna take it
One
from
to
one to
two.
two.
Because once you get to 2, then I can go to 4,
Okay.
right?
Like that. Yeah.
Yeah. Yeah,
I,
because it's
I think
very
it's true.
doable, right? We shouldn't minimize
Yep.
small, small incremental accomplishments. They're extremely
Progress is
important.
progress.
Yes, very important. The second half of your question,
Yes.
what do I tell for providers? It's actually very simple, but it's not easy.
Okay.
I think the number one reason why I find that my patients come back and why the practice is successful is because in my program there is no judgment.
Hmm.
There's no blame, there's no judgment, there's just compassion. We all suffer, everybody suffers. Some people suffer physically, some people suffer emotionally. It could be relationships, it could be physical health, anything, but we all suffer. And we all have things that we're challenged by. And if we just approach people without judgment and with a little bit of compassion, I guarantee you they'll come back.
I love that. I think for everyone that's hard. Clinical, not clinical. I think there's times where we're like, oh, that was interesting. Or, our mind starts to go there, right? But I really like your approach of really, really being consistent and intentional about that. Like I can see you. You want to help this person. And, I think being in your field, you are and in your position, you're being told maybe some of the deepest, darkest secrets that someone may have, or something that they feel so embarrassed about, maybe that they've held on to forever and they haven't been able to share with anyone except for you. And to be able to help that person achieve, their health goals is amazing and I'm sure extremely rewarding. So I think
That's a
that
really great point you bring up. Let me just say one thing about it. And what you're basically saying, and I think that's really important, is our job as practitioners is to create a safe space. When somebody comes here, our job is to make them feel safe so
hmm
they can share anything without judgment. And that and that's part of the therapeutic process. Is the doctor-patient relationship is part of that process of just it's a therapeutic recovery and growth and health and wellness is having a place, at least there should be one spot in their life at least where they feel safe enough to share anything. And that's our job as practitioners.
Absolutely. Couldn't agree more with you. And to round off today, from people that are listening in that, oh, maybe their minds are the light bulbs are going off and they're like, "Oh, I need to see Dr. Goldfarb. There's something I've been holding on to for a long time, or I've been told no, or I can't, no one can figure me out." Would love for those folks to be able to reach out to you, if you can tell us, the best method for that. But then also, since you've had such great mentors in your life and you've given such great pro tips for our providers that are listening, maybe there is also a chance for them to also call in or ask a question. And so I would appreciate telling us all where is the best place to learn more about you and your practice and where they can reach out.
So our website is ngoldfarb.com. And like my first name, Goldfarb, last name.com, has a phone number, has a way to fill out a questionnaire. There's a few videos on there. You can read about things that I do. Somebody, when you call our office, somebody actually answers the phone, and I will get a message, and I call people back. So if anybody wants to reach out, they have questions, they want to know something, practitioners, they have questions, I'd be glad to speak to anybody. So ngoldfarb.com is really the easiest way to get more information and to get a hold of us.
Fantastic. Well, Dr. Goldfarb, it's been a pleasure. We're we're very appreciative of your time here, and we hope to have you on again.
Thank you. My pleasure. Thank you so much for inviting me.
Of course.